Hi, my name is Diana Valentine, and the question I chose to research is in postpartum mothers, how does nursing led breastfeeding education with bonding focused support compare to standard postpartum care? And how does it affect maternal newborn bonding and breastfeeding initiation and continuation rates within the first 6 weeks of postpartum? I believe breastfeeding and maternal bonding are important elements of the postpartum care and influence both the immediate and long term health outcomes. Research has proven that breastfeeding not only promotes nutritional benefits for infants, but also promotes skin to skin contact, eye contact, thermoregulation, and emotional responsiveness for infants. For mothers, breastfeeding also provides the hormonal release of oxytocin and prolactin, support maternal attachment, and encourage self confidence. All these interactions strengthen the early attachment between newborns and mothers. But despite all their benefits, many women stop breastfeeding early. Research has shown that this is often due to lack of education, limited professional support, and decreased confidence and unresolved breastfeeding challenges. And unfortunately, standard postpartum education often include brief instructions that can poorly prepare women for the difficulties that may arise after discharge. There are several reasons why I chose this topic. As a new graduate nurse working in postpartum and labor and delivery, I observed many challenges women face from laboring to postpartum recovery to the initiation of breastfeeding. I'm with them throughout the entire journey, and many women require significant support, guidance, and encouragement when learning how to breastfeed. Through my experience, I've recognized how essential breastfeeding education is for both nurses and for patients. I initially struggled with learning different breastfeeding positions and identifying what a good latch looks like, and I struggled with developing skills needed to effectively support and educate my patients. So, these challenges help me empathize with my patients and realize that there's a lack of breastfeeding education for nurses. It has also helped me to understand the difficulties that many of these women face time and time again. So, through my research process, I have found inconsistent breastfeeding education and support for postpartum women. While researching this topic, I used three different research studies to gather my evidence. I found articles that compared structured breastfeeding education interventions to standard postpartum care. And all of these studies measured breastfeeding success using standardized assessment tools and examined maternal confidence, breastfeeding effectiveness, and bonding outcomes. Some of these tools utilized were breastfeeding self-efficiency scale, the latch assessment score, and the IOWA feeding attitude scale, as well as the maternal to infant bonding scale. Researchers collected data through questionnaires, surveys, and observation during the breastfeeding sessions. And through my research, I have found that all the articles agreed that structured and interactive education is more effective than just standard postpartum education. One study found that the teach back method was significant enough to improve maternal confidence and breastfeeding success. Another study focused on adolescent mothers who received structured prenatal and postnatal breastfeeding education were more prepared and had higher breastfeeding success rates than the control group. And then the third study found that a hybrid breastfeeding counseling group had an increase in breastfeeding continuation rates and improved breastfeeding behaviors. As mentioned before, research proves that structured breastfeeding education benefits women and infants, which contribute to better health outcomes for both. The evidence presented supports structured breastfeeding education, but however, there are still some limitations, such as small sample size groups, lack of self reported data, short follow up periods, and limiting evaluation of long term breastfeeding continuation and bonding outcomes. But despite these limitations, studies consistently demonstrated positive outcomes from nursing led breastfeeding education. And so, based on these research findings, I propose implementing a structured nursing led breastfeeding education program and a postpartum support group offered once a week in the hospitals. The pilot program would include hands on teaching for breastfeeding techniques, teach back methods, bonding practices such as skin to skin, led by nurses. as well as a support group led by a lactation nurse that would allow women to feel connected, comfortable to share their challenges with other women, and also build rapport with the nurse. This approach would help improve patient education and breastfeeding success. To begin this change, a lactation nurse would help nurses receive standard breastfeeding education techniques, such as different positions, what a good latch looks like, and utilize the teach back method to help improve those outcomes. New graduate nurses should have at least 1 to 2 days of their orientation to follow the lactation nurse to help reinforce the education provided. Patients would receive structured breastfeeding education during their hospital stays, along with written educational material and the opportunity to attend the support group whenever they'd like. To evaluate the success of the pilot program, several outcome measures need to be assessed. This would include breastfeeding initiation rates before discharge and breastfeeding continuation rates at 6 weeks postpartum, as well as maternal confidence using surveys. The support group would allow women to feel connected with other women, share their challenges, have guided support and education to a successful breastfeeding journey. I believe breastfeeding is not only a nutritional choice, but also an important component of early maternal infant bonding and infant development. When mothers receive clear guidance, hand on instructions, and emotional support from nurses, they are more likely to feel more confident in their ability to breastfeed and to continue breastfeeding after being discharged home. So, in conclusion, research demonstrates that structured nursing led breastfeeding education truly improves breastfeeding success and maternal confidence, as well as maternal and infant bonding. I truly believe nurses are amazing advocates for patients and play a important crucial role in educating, supporting, and empowering mothers during this important transition of life. I also believe that nurses help create a healthy and positive experience for patients during their hospital stay. So, integrating evidence based breastfeeding education into postpartum practice has the potential to enhance the quality of care, improve patient satisfaction, and support long term maternal and infant health. And so, ultimately, investing in comprehensive breastfeeding education and support for nurses and for patients is an important step towards improving patient safety, strengthening family health, and providing positive outcomes during the early postpartum period. Through my research, I've noticed that I've been implementing these things into practice during my day-to-day work experience, and I truly believe it makes a difference, and I will continue to support mothers who want to breastfeed. And so, thank you for your time and attention.